I want to welcome Dr. Mavis Billups. She is the medical director of City of Angels Dermatology. She's a cancer specialist, board certified in dermatology by the American Board of Dermatology, and has been serving in the medical community for over 16 years. Please listen closely as she unlocks some of the secrets to healthy, radiant skin and gives us expert insights and practical tips on how to keep our skin looking its best. And she will also be joined by Regeneron's team that are going to be here with her as well on stage. So please, let's welcome our last panelist of the day.
Okay, first of all, this program is sponsored by Regeneron Pharmaceutical Incorporation. The speaker, I am a paid consultant for Regeneron. However, the goal of this talk today is to enlighten you, empower you, and get you engaged on taking care of your skin. Skin diseases in our community that I want to highlight today, some are really common. Atopic dermatitis and eczema, Prurigo nodularis, and cancer. And many of us don't think of us as having cancer, but we will talk about it a little bit later. Atopic dermatitis, many of you know someone with eczema. Atopic dermatitis, it presents, it's chronic inflammation in the skin. It really onset in childhood. You can see small kids constantly itching, rubbing, skin discolored. It affects 20% of African American, 16% of Caucasians, 8% of Hispanic children. But it can occur at any age because I have a lot of adults in my practice with atopic dermatitis. African Americans, Black, and Latino children have more severe disease. I don't really think it's just as severe, but presentation, by the time they present, is severe. Many of us, I don't want to say ignore, but in our communities, we will try different remedies for a long period of time. And by the time you get to the doctor, yes, it is advanced. So I don't think it's just as severe in origin, but I do feel that by the time we present, and also by the time those who are taking care of us identify what's going on, it may have progressed to an advanced stage. Many times there's a family history, so it's important. So if you know you have a child or a grandchild and you had eczema or atopic dermatitis, and you see those signs early on, please do something about it. The skin in this situation is very dry, itchy, inflamed, and for me, I get really annoyed when people say they can't see inflammation in skin of color. Come on. In skin of color, inflammation is inflammation. The skin is rough. It may not be hot pink, but it is a little burgundy, so you can see that. It affects the face, it affects the arms and the legs, and quite often that patient may have asthma, allergies, hay fever. Take a history, Some foods may also cause it to flare. And for me, I'm always inquiring about gluten, and I know we are in a gluten-sensitive society, as well as dairy. So you have, bring these up and pay attention to your cousin, your child, your grandchild. Wait, every time I give them a a sandwich, they flare up. So that person may not be able to deal with gluten. So pay attention to that. Here are some photographs that kind of highlight. See this ring around the mouth. This is very common. Take a look at kids. When you see this, they should really be seeing someone because that can get itchy and they can rub it to the point that they develop lines in their skin. This was a little baby brought to me and patches were everywhere. This is right behind the knee. And you can see the inflammation there. You can even see the inflammation in the back. There are multiple patches all over the place. And when you close your eyes and run your hand over this back, it feels like sandpaper. We are not designed to feel like sandpaper. So when you feel it, let your antenna go up. Here again is that same little baby. It was all over the legs. In adults, many times it's been there so long. We're talking about years in and years out. And what do we do when we're itchy? Yes, we scratch and we rub. And when you rub the skin, our skin is a living organ. It is going to react. It reacts by getting thicker, and we call this little process lichenification, so it gets thick, and you have these little thick bumps, and people sometimes can get this to quiet down, but as long as that's present, I know that person is not healed. So they still can be healed. This is not, this is not a full completed treatment as far as I'm concerned. So even though you may have this and you're not itchy, you still look kind of like right on the cusp of flaring at any second. What can you do? First and foremost, seek medical care as soon as possible. Many primary care physicians are very well trained to take care of this, but if you go to someone and they are not addressing your problem, doggone it, ask for a second opinion, ask for a referral. Don't just, you control your own health, but you honestly have to be proactive and step up and inquire about things, okay? Avoid activities, foods, or products that cause you to flare. It kills me when my patients come in and say, oh, but I just love yogurt, but every time I eat it, I break out. Well, doggone it, let it go. Because if it's creating that kind of problem in your skin, stretch your imagination to what the heck it's doing internally. So let it go. Develop a good hydration regimen. That's really a key part of it too. Medications can work great, but you have to have a good hydration going on. Here in Southern California, I often tell my patients, we honestly live in the desert that sits on the ocean. This is the driest climate I've ever lived in. And I grew up in Mississippi, okay? And we have humidity here. You come here, I slather. My husband say, you slather all morning long. Doggone right, because I don't like to be dry and I don't like to itch. So develop a good hydration regimen. For the winter months, once again, our climate is dry. We turn the heat on when it gets 60 degrees in LA. You know how we are. Heat dries out our skin. Run a humidifier in your bedroom. It can help make a difference. Lastly, any place you have inflammation in your skin, I don't care what the inflammation is from, you are going to heal up with more pigment. That's just how our skin heals. Wear some sun protection, because a lot of times patients, the active disease is gone and they're in, my skin has all these scars all over it. They're not scars, it's pigmentation, but you can prevent the pigmentation by using sun protection early on in the process. I think we should be using that stuff every day, okay? The next disease I want to talk about quickly is Prurigo nodularis. This is an extremely itchy skin condition that leads to a bumpy rash. And the lesions are pretty much located on the arms and the legs, places where you can reach. Now, there are certain conditions that we all encounter that cause us to be itchy, but it's almost like it just keeps going. So you scratch to the point that you get these little nodules. Various diseases, and many of us may have them, thyroid disease. You can have itchy skin and thyroid disease. HIV and hepatitis. Type 2 diabetes, we all are familiar. And some organ, skin, and blood cancers can also make our skin very itchy. This is the clinical picture you will see. This is treatable, people, but you keep scratching, there are a lot of nerves here, and this problem can persist. So when you have this, or if you have this, or if you know somebody with this, tell them to see somebody because it can be treated. Once again, what can you do? Seek medical care as soon as possible. Your physician will work with you to develop the best clinical treatment for you. It's not one thing is perfect for another. As you saw, multiple things can create the underlying itching. So you want to work with your clinician to address it. You also want to, once again, avoid anything that tends to trigger and that makes you itchy. Avoid those things. You're going to hear this all day. Protect, protect, protect. Sun protection, SPF 30 or higher should be worn, because those little spots, when they heal up, there would be black marks all over the place. If you incorporate using your sunblock, once they heal, your skin is back to normal, okay? The last category I want to go over with is skin cancer in patients of color. Now this one really, this is close to my heart because we as people of color, and I hear it in my practice, and I know it's not here, but people come in and say, we don't get skin cancer, Dr. Billups, we have pigment. Well, doggone it, you need to tell that to the 200 people I've already cut who look exactly like me, okay? We do get skin cancer. You only need one thing to get skin cancer. Do you know what that is? Thank you. Thank you. Thank you so much. That's it. You just need one thing to get skin cancer, and that's skin, okay? Sorry. The three that I do want to highlight, squamous cell, basal cell, and melanoma. If you have skin, you can get skin cancer. Squamous cell is the most common skin cancer in African Americans and South Asian patients. The thing, now, unlike our Caucasian counterparts, no, we may not be out there burning and getting sunburns over and over, but there are conditions that make us more vulnerable to skin cancer. Transplant recipients, ring a bell? Albinism, albinos, vitiligo, history of outdoor employment and activities. Lupus is prevalent in our community, discoid lupus, chronic leg ulcers, history of radiation treatment, history of any type of burns, and hidradenitis suppurativa. When you look at this list, the top three entities have to do with your skin and your skin being able to repair sun damage, the top four. The bottom, five, have to do with situations where you have a chronic sore, a chronic lesion. And that's how I divided this list. And all of us, when you look at it, you can think, oh, wait, I have swelling in my leg, I break down, I have an ulcer. Let's just go through some of these. For us in our community, I know diabetes is prevalent. It's extremely prevalent in my family. Hypertension. When we don't control these two bad boys, you are going to be on that list. So this is just not about making sure you do well day to day. This has major impact on your overall health. So people, control your diabetes, control your hypertension. It's important. If you're not controlling your diabetes and hypertension, you are going to end up on the transplant list because both of those guys in their own way create damage to our kidney and our heart. Yes, liver and lung, there are issues we have to be concerned about, but common diabetes and hypertension, not controlled, you're talking about chronic renal failure. 75% of people who have chronic renal failure is due to uncontrolled diabetes and hypertension. Come on, we can nip this in the bud. We really can nip this in the bud. Dilated cardiomyopathy. This is when that high blood pressure is not controlled. Over time, it damages your heart, and now your heart can't do its job. It now becomes like this big balloon that won't even pump the blood. So now you're on a list for a transplant. So what happens when you get a transplant? Before, when we were all born, God was wonderful. He gave every last one of us a repair mechanism in our skin. That immune system is designed to keep the sun from damaging us. It's also designed to keep organisms out, keep us from getting bacterial infections and viruses all the time. Now, once you get a transplant, your doctor has to place you on medication to keep you from rejecting that $432 million organ you have now been gifted. So even though you are using medicine to maintain your organ for life, don't get me wrong, that's important. That medication now is impacting your skin's ability to do the job that God gave it to do, okay? So now this is where the risk of your skin cancer start going up. And this is why it's important for us. For those of us who may be contemplating a transplant or even who's dealing with renal failure, please have your provider start sending you to a dermatologist now, because it's important for you to get diagnosed early, and it will happen because it's just the way the medication works. It's important to see a dermatologist every year. Once you have that transplant, don't let them fool you and don't tell them they won't pay for it. They're lying. You see a dermatologist every year. Doesn't matter if you've never seen one before. It's my hope that if you have a transplant or you know someone who's getting one, that they start off. That's part of those appointments you get before you have that transplant surgery. Here you can see some of the chronic ulcers. Right here on patients who have long-standing sores from stasis dermatitis, what we call it. These things, when they don't heal, we have to biopsy them. Many of them have already progressed to skin cancer. Oh, did I skip? Oh, no. Vitiligo, there is no pigment in those little pink patches of skin, so that skin has no way of repairing damage. If you have vitiligo, you have to protect that skin from the sun because it's vulnerable to burning extremely easily. Here you see it on the upper extremities, and most of the time it can be in places where people can see it, so you have to make sure you protect yourself. Here is a photograph of a young woman with discoid lupus. And discoid lupus is such, it seems that every time you have a flare, that inflammation goes right back to that same location. So over and over again, you start having scars, atrophic scars, white scars that now are prone to develop skin cancer. Here is a transplant patient who just came in because they had these warts growing. This actually was squamous cell, okay? Had never been seen before, but that was the first time, and they had squamous cell. Here's a photograph taken from a brochure by Regeneron showing squamous cell on the scalp. When you start having these little growths, don't think the warts are going to go away. Please see someone, okay? Here, there's a condition that I mentioned called hidradenitis suppurativa. Hidradenitis is a condition where we get recurrent boils in our armpits, in our groin, and they keep coming over and over, and most people can't heal them up. It can be a very debilitating condition. Just like it can be debilitating, sometimes these chronic tracts are created. They're not healing. Once again, it's an ulcer, and it's in a hidden location, but they can get skin cancer, something that won't heal. You have to think that. Basal cell, this is the most common skin cancer in Hispanic and East Asians. It's found in uncovered and covered skin. It presents as a colored bump, but trust you, you have skin that has a basal layer. We all can grow this. Here, I'll never forget in my residency, a young 28-year-old beautiful African-American woman showed up, and she had a little bump on her face. And I went to my attendant, who was a Caucasian gentleman, and I said, you know, if she was Caucasian, I would think she had basal cell. He said, well, why don't you think she has basal cell now? I said, because she's black. And he looked at me, he said, oh, really? I biopsied 27 basal cell. Here is how it can present on our skin, a pigmented lesion that's growing all over the place. This is another photograph from the brochure by Regeneron. Here is another. If you have something that looks like a pimple, and you feel and you pop it, and it bleeds and heals up, see somebody. That's not a pimple. It could be a skin cancer. Here is another one on the thigh. This is just to reiterate, it's not only going to be on your exposed areas, it could be anywhere. Pay attention to your body. Just, if you have suspicious growth, see someone. Melanoma. Are many of you Who remembers Bob Marley? Yeah, one love. Yeah, there we go. Bob Marley could still be here if it wasn't for this bad boy, okay? Bob Marley had a dark spot on his toe. He ignored it, and it was melanoma, and that's what took him out. This is what's a little alarming to me. Melanoma 5-year survival rate in blacks is 70%. Compared to Caucasians, it's 94%. Black patients are 3 times more likely to be diagnosed with advanced melanoma than whites. Hispanic patients are 2 times more likely to be diagnosed with advanced melanoma. In the past 2 decades, there has been a 20% increase in melanoma in the Hispanic population. Now, there are a couple of things that can account for this in my mind. Number one, we are not getting full body skin exams yearly. Everybody in here should be getting one. I don't care what people tell you. Tell them you want to see your dermatologist for a full body skin exam. In between those appointments, there are 3 places there are 3 people who can help you with your skin. Number 1, your hairstylist, your barber. When they're up doing your weave, your braids, your press, your perm, your cut, just say, hey, do you see any flat, dark moles, okay? When you go to have your yearly exam, ladies, your pap smear, when your feet are in those stirrups, whoever is down there looking, just say, hey, do you see any flat, dark moles? Most of the times when they're doing that exam, they're looking for kind of a lot more inflammation, which is indicative of squamous cell, which we have to be concerned about. So a tiny little mole on your labia may not resonate until you say something. So bring it up. And then lastly, when you roll up into these salons to get your toes and your fingers done, flat, dark moles. That person, when they're massaging that little moisturizer on your feet, have them look at the soles of your feet. I'll admit, the number 1 cause of pigmentation on our nail bed is trauma. However, if you have pigmentation that's growing from the bottom of your nail all the way out, see someone. If you're concerned and you can't remember if you traumatized your nail, see someone. Because this is why a lot of times we present at a later stage. Melanoma in skin of color, as I just said, are in the hidden areas. So be mindful of that and incorporate that into your routine care. Men, when your doctor is doing your prostate, tell them to check underneath. Say, hey, do you see any flat, dark moles? Because it will grow everywhere. Everyone, they're going to do a rectal exam. When they're back there, they should be looking at your anus because it can start there. So your skin is important, but you have to be aware and you have to bring it up. Here is an example of melanoma in the nail bed. Here, it's on the sole, this little black spot, and I was doing a full body exam on this person. I'm like, whoa, when did you get this on your foot? Their response was, what? Okay, we thought they had stepped on something, so I rubbed with alcohol, it didn't move. Biopsied, it was an early melanoma. I put this up because, if you recall, I talked about outdoor activities. A patient of mine came to me who taught swimming, and he had a similar lesion on his back. It was red. I don't know what I thought it was, but I did not think melanoma. I took it off. It was melanoma. There's a form of melanoma that's not going to be black. It's not going to be dark. It's going to be pink or red, and it's called amelanotic melanoma. So don't just think it has to be super dark and black to be aggressive and bad for you. Anything that's growing out of the ordinary, please see someone. What can you do? You can control your chronic disease in terms of diabetes and hypertension so that they can not have to progress you to the transplant list where the skin cancers can be prevalent. Use daily sun protection. I'm a little snob when it comes to sunblock. I think as you buy it going forward, turn it around, see what's in it. I'm a big supporter of titanium and zinc. Titanium and zinc will behave like your clothing. They reflect the sun, they bounce the rays off, and you have to reapply it. For those of you who are outdoors all day long, every 2-3 hours you have to put it on. It's a small price to pay to maintain healthy skin. Avoid outdoor activities if you can between 10 a.m. and 2 p.m. That's when the sun rays are the most dangerous and intense. Know your family history. If you know Uncle Bud had melanoma, you should be getting checked. If you know your grandfather or your grandmother had melanoma, you should be checked. There is a strong genetic connection for melanoma. For the other skin cancers, it's not as strong. It's really not there. It's kind of like our lifestyles that place us at risk. But melanoma for sure. Yearly, everyone in here should have a full body exam. Go home and tell all your friends, your families. Go on your social media account. Tell everybody, hey, we should be getting full body skin exams. Because you won't find stuff if you don't look for it. Okay? And that's part of how we are to stay healthy. If you have a fast-growing bump on the skin, see a dermatologist. If you have a slow-healing wound, see a dermatologist. If you're suspicious of a new spot on your skin, what are you going to do? See a dermatologist. Yeah, baby. Your physician will work with you to determine the best. And so many of the skin cancers are treatable just by surgery if they are detected early. And that's why I want to impart on you, please, if you see something, seek help early, and it's really treatable and curable. So in closing, I hope you have been enlightened so that you can be empowered and that you will become engaged earlier to be proactive and take control of your health. Thank you so much for your time.
Dr. Billups, that was amazing, and thank you so much for just talking about the conditions that really impact people of color. I was one of those individuals who felt like, I have melanin, I'm dark, there's no way I'm ever gonna get a sunburn until the day I received a sunburn. And I didn't know what it was. So there are a lot of us who feel and believe that. And just by way of introduction, I am Sandra Graham Mason. I do work with Regeneron, and to my left is my colleague, Christine Huey. And she has her PharmD and works in our medical science liaison department, and I work in our oncology department in marketing. But we all feel very passionate, as well as our colleagues in the back, about diversity, equity, and inclusion. And that's why it was so important for us to participate and to also work with Dr. Billups to have her talk about the importance of skin, not only from some of the inflammation and chronic diseases that we live with, but also some of the other conditions that we're just not talking about as a community, and those are skin cancers. But Dr. Billups, a question I did want to ask you before, and if there are other questions in the audience, please come to the mic. One question I wanted to ask you is that when we have doctors, especially some of our primary care doctors or internists, we do develop relationships with them, and we feel like we are very committed and we don't want to hurt their feelings. How do you suggest a person recommend getting to a dermatologist if the doctor feels that I can treat you here, but don't want to give you that referral to a dermatologist? What should they say to advocate for themselves, for that empowerment that you talked about?
Hurt their feelings. No, that's not it, that's not it. I hear what you're saying, and yes, you know, these are going to be people there for the long haul. Just always start off by acknowledging the work that they've done. Say, you know what, I so appreciate everything you have done and you are doing for me. But, you know, I've just been informed that this can be lifelong and I can have long-term consequences. Can we just see, can I just see someone else? Can I just see a skin specialist? Can I just have one visit with a skin specialist to have some deep questions, and concerns addressed? When you phrase it like that, I used to be a primary care physician. I used to be a pediatrician. You didn't have to ask me but once. I'm like, okay, yeah, let's go. Because as a primary care physician, I didn't know the answers to the detailed questions. And no one wants to be put on the spot. But I think if you start by just acknowledging everything that they've done and just say how much you appreciate, but you just want to get more knowledge to be better equipped to deal with this, I don't think you have a problem. I really don't, okay?
Yes, absolutely.
Can I ask one more question? And this is going on to help empower our audience here. For me, just learning more about how dermatologic conditions or skin conditions present differently in the skin of color population. Do you have any tips on how the audience can advocate for themselves if they feel that they've got the incorrect diagnosis, that their prescriber is giving them therapies but they're not getting better? How can we empower ourselves? What are the questions we can ask?
Well, that's a good question because we're all human. I've actually had the wrong diagnosis because sometimes when you present, the full picture may not be there. And, in my haste or someone else's haste, they may not give you the right. I appreciate when a patient comes back to me and say, hey, this is not working. Because typically that's how I open up my conversations with people who are in for follow-ups. I say, what's working and what's not, okay? If you have to go back to your primary care, to your provider who has given you something and not working, just say, you know what, this is really not working for me. Can we, and I don't even know if you want to say, can we try something else? Can you just relook at me? You have to advocate for yourself. As a community, that sometimes we are shy when it gets to our medical care. Please don't be. We are responsible to you. We are there to help you. And if we don't know we're not helping, tell them. And so what if the doctor get mad? They may not be the right provider for you. Do not hesitate to use your insurance company because insurance companies make their money off of you, okay? And they want you to be happy, so you stay with their plan. So you can always call up and say, hey, do you have someone who may be more sensitive to me, culturally sensitive? And that culturally sensitive person may not always look like you, but the insurance company will know who they have had great success with in their, in their doctor pool. So yes, you can always go to them and even, try your physician first. Yes.
Yes, about eczema. Just wondering, is it contagious? And I'm not, eczema, I've had it, I can struggle with it since childhood. But when one time I went to a dermatologist, they told me not to use hydrocortisone because they said it's skin.
Don't use what? I'm sorry.
The cortisone steroids, cortisone, hydrocortisone, because they said it thins the skin and makes it more likely for it to come back. Olive oil, I've noticed it'll help with the itching. It doesn't get worse if I put olive oil on it. Oil of oregano actually will clear it up. But are there things that what is appropriate? If you can't use hydrocortisone, then what can you use? What's effective? And what really is causing it?
Okay, those are all good questions, and I think beyond the scope of this, but I am going to address one thing you said. It is not contagious. Number two, I am going to address all those steroids can thin the skin when they're used inappropriately. So part of me wants to say to you, and I'm not asking, who told you that? But I'm not asking, okay? So, that maybe you want to find another provider because there's a plethora of medications that can be used to give you relief. Now, let me just say this. We do not have a cure for eczema, all right? Because there's an underlying genetic issue with your whole inflammatory, the inflammation system. And it's almost like there's a deep inferno going on inside of the skin. we can get to the point where we put the inferno out, but there's so many things, even your emotions, that can start that inferno back up to have you have issues on your skin. So corticosteroids have a place in there. I use them, but they are not for long-term use. That I will agree with, okay? That I will agree with.
Great. My question is related. My mother is a breast cancer survivor. She's celebrating a year. She went through chemo and all the other great stuff. But my question is around her skin, because one of the challenges that she has now, whether we go out during the day, is when it's really hot, her skin will automatically start to blister, or it's just, she gets the itch and then the real extreme redness. And one of the suggestions that I had to her doctor was that she go see a dermatologist. And the common question has always, the common response has been, this is just another, I guess, reaction, or I forgot what the term doctors normally use, as a byproduct of chemo and all of that. So, of course, I would love for my mother to be back in a space where that doesn't happen again. And I was just wanting to know what was some of your thoughts or maybe recommendations that I could have as far as a conversation with her doctor.
Well, one thing, if you notice, I kept saying we have to protect ourselves from the sun. Sometimes we are on medications. After we've gone through chemo, medications can make our skin way more sensitive. So physical sunblock and even clothing, okay? I as a child growing up in Mississippi, I used to look at my grandpapas and say, God, why are they wearing a long sleeve shirt to plow? They had way more sense than I did, okay? I don't think together they finished the 5th grade, but they would plow with old white shirts on because it would reflect the sun and they never got burned, okay? So I know people are used to, we're used to wearing our arms out, we're used to exposing our beautiful bodies, but you can still do that, but you have to have the right sun protection on. There are a whole lot of reasons that she's having that reaction, but she can protect from it by, there are several companies that make SPF clothing, okay, that she can utilize. Or just even long sleeve, 100% cotton is another thing that's very protective, as well as those physical sunblocks, anything with titanium and or zinc, as long as it's SPF 30 or higher, they work like clothing. You can still see the skin, but they reflect the sun. They just have to be reapplied, okay? All right, thank you guys for your attention, okay? And your time.